You're about to make a significant investment in your mouth. How can you assure long-term implant success? A dental implant is nothing more than a screw. The outside threads go into the bone, and then at the top you'll see the dental implant receptacle that holds the teeth. Let's look at an upper front tooth, the upper right central incisor. Looking at it from the side, if we look at the left side, you'll see that you need 2 millimeters of healthy bone to provide a sufficient blood supply to a dental implant. But most people have less than 1 millimeter of bone surrounding their natural tooth. That doesn't provide sufficient blood supply to the bone itself. So when this tooth is extracted, you'll lose some bone and some gum tissue. Here's a tooth socket with a normal 2 millimeters of bone. But if there's less than 2 millimeters of bone, this is what the socket may look like. An implant placed in such a socket would produce a tooth that looks like this. Besides that, the tooth would overlap the gum tissue, making it impossible to clean that tooth. A CT scan of that tooth shows the problem. The bone is very, very thin on the outside, thick on the inside. When such a tooth is extracted, look at the amount of bone that's lost. A similar problem would occur on a lower back tooth. Notice on the left side of the root, the bone is thick, but on the right side of the root, there's practically no bone. When such a tooth is extracted, look at all the bone that's lost. What do we do to provide a blood supply so that the implant-supported tooth lasts for a long time and looks like a tooth? How do we get to that magic 2 millimeters of bone? Let's look at a socket with a little bit of resorption, or even a socket with more resorption. How do we restore the missing bone and gum tissue? You'll see in this picture what we do. Notice the white membrane that's surrounding the bone graft. You'll see the arrow there. We tack that membrane into place and we shape the membrane exactly the way we want the ridge to be. We then place bone grafting material within the membrane and around your existing bone. And then finally we cover that with a soft tissue graft. You can now see the graft healed with thick gum tissue and thick bone. The implant is now nourished with a big, beautiful blood supply. Now we'll fasten your tooth to the dental implant. The bone is thick and has a great blood supply, and so does the gum tissue. There's your beautiful tooth in place that will look like this for many, many years. If you have any questions, please contact one of our staff members or one of our doctors.